Okay, hello everyone, and welcome to today's class session. Our topic for today will be focusing on understanding regional health with information technology, or IT. For the class session, or this online lecture, is essentially going to be broken up into two parts to reduce the amount of time you have to sit and try to focus on my voice for 15 minutes. But we're going to focus mostly on the health information technology side of understanding health, or understanding regional health, and then next week we'll give more conversation to health information management. So before we begin, I just want to address a few housekeeping notes. So the first one is for the discussion responses. They will be due by 11:59 p.m. on Sunday, and I'll talk more about that when I get to the embedded question. And then secondly, the quiz. The quiz will be posted tomorrow at 5 p.m. So this will give you essentially 3 days to complete the quiz. And like I said, you can complete the quiz in any environment that is efficient for you to concentrate. So that can be at home, that can be in the library. If for some reason you want to be at Starbucks and do the quiz, I mean, by all means, whatever fits your fancy. But also in a line with the other sections. So you will have 30 minutes to complete the quiz. So that I think that should give you adequate enough time to try to complete the quiz based on only 10 questions. And like I said, with the quiz, I'm not going to try to throw anything new or different that you haven't seen. Everything that's on the quiz essentially is coming from the PowerPoints, mostly from the PowerPoints, from the readings, and just our discussion in class. So I know, like, some professors, they can come out of left field with a question that has nothing to do with what you talked about in class. So that's not going to be the case. It's going to be very straightforward as far as if you paid attention. And then thirdly, on Tuesday, some folks from Ventureprise will be coming over to talk about some opportunities to basically, if you have an idea that you would like to look at more from a commercialization standpoint, they're going to talk about ways that you can try to commercialize your ideas. And essentially, you will work with a faculty member. In this case, you will work with me to work on a project or idea that you have. But at the end of the day, you, as the innovator, are driving the ship for this particular project. And I think there's like a small award that's associated with it. I want to say it's 3,000 or 4,000, but do not behold me to that number. They'll talk more about that on Tuesday. But it's a great opportunity if you have an idea and you're not really in line with going a traditional route as far as your next career move, and you want a more entrepreneurial focus in your next career move. I think this is a good opportunity. So they'll talk more about that on Tuesday. So let's go ahead and jump into the lecture for today. So last week we introduced the terminology of health information technology, and or health IT is defined as the application of computers and technology essentially within the healthcare settings. And then I think it's important to make sure you have a good grasp of, okay, what are some examples of health IT when we're talking about healthcare settings? And of course, we all know about electronic health records. So that capturing of not only your demographic information, but also your clinical information when it comes to, or when you enter into a space or healthcare setting space, from them to be able to capture the information that's necessary to do diagnoses, but also eventually help with prognosis based on the information as a result of the entire healthcare experience itself. So in electronic health records, I don't want to spend a lot of time on it because we're going to have a full week just talking about electronic healthcare records, but also talking about it from the data side. And then you also have consumer health IT applications. So these are also examples of health IT. Consumer health IT applications refer to a wide range of different hardware, software, and also web-based applications that essentially allow patients to participate in their own health via those electronic means. And I like the terminology consumer health informatics because essentially when we were talking about the concept of health literacy, individuals being more health literate, and then also the quantified self, that these health IT applications allow health consumers to be more involved in their own health, but also be more literate about their health conditions and concerns that they may have personally. And health IT applications allow that to happen. And of course, Fitbit is a good example of a health IT application that not only is the application capturing data about you as far as physical activity, but also your dietary behavior, but also allows you to input data into the application. And I know that some practices are now exchanging that data with patients, so patients are able to share their data or their fitness data with their healthcare providers. But of course, very similar, I think what we talked about on Tuesday was that slippery slope of how much data do you share, and then when you're sharing that data, now who becomes liable as a result of particularly the health consumer sharing that data with their healthcare provider, and what kind of protection does the patient have on the other side of that if there is a breach of their data. So you have to be careful with how or making that decision of sharing your data with regards to health IT applications. But we'll talk more in depth about the different types of healthcare or consumer health informatics later in the semester. And then the other terminology that's important when it comes to having this discussion about health IT and understanding its impact with impacting regional health concerns. So health disparities are essentially those preventable differences in the burden of diseases, injuries, and various opportunities to achieve optimal health that are experienced by socially disadvantaged populations. So essentially, those socially disadvantaged populations are hindered by their ability to, particularly when we're talking about mobility-related issues, to address diseases that everyone should be protected against, or injuries that everyone should be protected against. In a lot of cases, those populations are dealing with issues of poverty. They have certain environmental threats when we're talking about the socio-ecological model within the realm of public health, and then also educational inequalities that exist. Research has consistently showed that the difference between, particularly if we were having a conversation about health literacy, that individuals, that as your education increases, that your overall health literacy also increases, and your ability to be more informed as a health consumer. And then that same conversation, I think it's important to have an understanding of social determinants of health. So social determinants of health are those conditions in the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, function, and quality of life outcomes and risks. So these two different definitions are essentially connected to each other with understanding or trying to understand health disparities that exist within a community or amongst a particular population. So the good example of that, in this case, let's take out this whole notion of socially disadvantaged populations. We'll just focus on the concept of educational inequalities. So you may have an individual who resides in a particular environment where they do have quality education. So that's not a concern for that individual. But they may work in an environment where their health is constantly threatened. That can be by either pollutants in the air, or that can be by the overall work conditions that they're required to participate in as a result of being in their environment and working. So it's important to understand the connection between this idea of essentially we have health disparities, but also this more encompassing idea of the environments that people work in also impacts those health disparities. So it can become very complex when we look at it from that perspective. So I'm going to stop here with regards to the terminology, and then we're going to pick up in the second component, focusing on health information technology and health disparities, particularly trying to answer the question of, okay, how does health information technology, or why do we use health information technology to address health disparities, and how do we get that information from that? So I'm going to stop here and follow me over to the next lecture.